Introduction. Severe Acute Respiratory Syndrome, SARS, is a viral respiratory illness that gained global attention in 2002-2003 when it caused outbreaks in several countries. The disease was caused by a previously unknown coronavirus, later named SARS-CoV, which belongs to the same family of viruses as the one responsible for the ongoing COVID-19 pandemic. In this article, we will explore the causes, symptoms, and preventive measures related to SARS. 1. Causes of SARS. SARS is caused by the SARS-associated coronavirus, SARS-CoV. The virus is believed to have originated in bats and possibly transmitted to humans through an intermediate host, such as civet cats, in wet markets in China. It spreads primarily through respiratory droplets when an infected person coughs or sneezes, but it can also be transmitted through close contact with infected individuals or contaminated surfaces. 2. Symptoms of SARS. The symptoms of SARS typically begin with a high fever, usually over 100.4 degrees Fahrenheit, 38 degrees Celsius. Other common symptoms include headache, body aches, chills, and overall discomfort. Within a week, respiratory symptoms such as a dry cough and shortness of breath may develop. In some cases, the disease can progress to severe pneumonia, leading to respiratory failure, which can be fatal. It is worth noting that not all individuals infected with SARS-CoV develop severe symptoms, and some may even be asymptomatic. 3. Diagnosis and treatment. Diagnosing SARS involves a combination of clinical evaluation, history of potential exposure, and laboratory testing. If SARS is suspected, healthcare professionals may conduct tests such as a chest X-ray, blood tests, or a polymerase chain reaction (PCR) test to detect the presence of the virus in respiratory secretions or blood. There is no specific antiviral treatment for SARS, and supportive care remains the primary approach. This includes managing symptoms, providing oxygen therapy, and using ventilators in severe cases. 4. Prevention and control. Preventing the spread of SARS requires a combination of personal hygiene practices and public health measures. Here are some preventive measures. A. Wash hands frequently with soap and water for at least 20 seconds. B. Use alcohol-based hand sanitizers when soap and water are not available. C. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. D. Wear a mask if you have respiratory symptoms or are in close contact with an infected individual. E. Avoid close contact with people who have flu-like symptoms or have recently traveled to areas with SARS outbreaks. F. Clean and disinfect frequently touched surfaces regularly. G. Follow public health advisories and travel restrictions during outbreaks. 5. Lessons learned from the SARS outbreak. The SARS outbreak served as a wake-up call for global health systems. It highlighted the need for improved surveillance, rapid response capabilities, and international collaboration to control the spread of infectious diseases. Since then, countries have made significant investments in public health infrastructure and pandemic preparedness, leading to better early detection and response to outbreaks like COVID-19. Conclusion. Severe Acute Respiratory Syndrome, SARS, is a respiratory illness caused by the SARS-associated coronavirus. It is characterized by fever, respiratory symptoms, and can progress to severe pneumonia. While the SARS outbreak of 2002-2003 was successfully contained, it reminded the world of the importance of robust surveillance systems, rapid response mechanisms, and international cooperation in the face of emerging infectious diseases. By following good hygiene practices and adhering to public health guidelines, we can minimize the risk of future outbreaks and protect public health.